I'm Joan Blau. I'm the Senior Director for the Child Care Innovation Fund here at the Early Childhood Investment Corporation. I'm going to be the moderator today. And we have two esteemed presenters and colleagues, Teresa Hawley, who is the Executive Director for the Center for Early Learning Funding Equity that's located in Illinois, and Rakaya Anbar Shaheen, who is the Director of Early Childhood at DC Action in Washington, DC. So we're going to start out by just spending a few minutes talking about Michigan efforts that are underway to educate and call for action on early care and education workforce compensation. You may or may not be familiar with these efforts, which is one of the reasons we wanted to just take a few minutes today to talk about those. I'm going to talk first about some of the work that the Early Childhood Investment Corporation is doing. And Terrell and others are going to be placing this information, links to this information available for all of you. So we worked with Talent First, which is a CEO alliance located in West Michigan, to put together a proposed statewide wage scale that would bring early care and education wages to parity, comparable with K-12 for similar credentials. One of the reasons that we wanted to do that is because the workforce in Michigan for early care and education has declined by over 27% since 2001. And 2/3 of the early care and education workforce in Michigan earns less than $15 an hour, despite over 65% of them having a post-secondary credential. One of the things that the Early Childhood Investment Corporation is doing with the balancing the scales, salary scales, is actually running a very small salary scale pilot right now with two child care business leaders, one in the city of Detroit and one in Northern Michigan. We'll be working on that pilot with those child care business leaders until December and look forward to publishing a report about their experiences to share with all of you. Another exciting project that's happening here at the Early Childhood Investment Corporation is the Infant and Toddler Quality Improvement Grants Project. This project is working with 200 childcare business owners and nonprofits who are serving subsidy-eligible infants and toddlers to help them pay their early educators a more comparable and adequate salary. One of the early findings from both of these initiatives is that these childcare business owners are finding that their struggles with retention and recruitment are easing, and they're able to hire new staff and expand access to services for young children. We've also been fortunate in Michigan that the U.S. Chamber Foundation, the Michigan Chamber, the Grand Rapids Chamber, and the Early Childhood Investment Corporation work together to publish how childcare impacts the Michigan workforce productivity and the state economy, untapped potential in Michigan. One of the eye-popping findings from this report that we've been communicating broadly to policymakers and other decision makers in Michigan is that Michigan is currently suffering a $2.8 billion loss in economic activity due to our childcare workforce crisis. And we think it says a lot that our partners in chambers and economic development organizations and businesses across the state all align to say something needs to change, and we've got to make progress on compensation for early educators. And finally, Think Babies Michigan, which is a statewide coalition of thousands of individuals and groups, parent leaders, philanthropy, a very diverse coalition, worked together last year to prepare a comprehensive fiscal analysis of the prenatal to 5 system in Michigan. We all know that the first 5 years are critical, but that programs and services for young children, in particular childcare, face persistent underinvestment. One of the important things that this report did was to look at available service capacity, current funding, it modeled costs, and it projected the revenue needed. The bottom line is that childcare businesses and employers in Michigan face unprecedented challenges in hiring and retaining qualified staff and paying competitive salaries and benefits. It's the biggest barrier we face to making progress on increasing childcare supply and being an important and critical contributor to both the school readiness of children, the ability of families in Michigan to work, and also for our state to fully recover from the COVID-19 pandemic. So what we're here to do today is to learn from states who are further ahead of us down the path and have been working for many years to address their childcare workforce compensation challenges. And they're going to share with us lessons learned. And then you're going to have an opportunity to get together in small groups and talk about which of these ideas do you think Michigan might be, should explore further? What are some first steps that we might take? So we look forward to you enjoying the opportunity to talk together. And I am going to turn it over first to Teresa Hawley to talk about the Illinois experience. And thank you so much for being with us today, Teresa.
Thanks, Joan. Just a word of introduction of myself. So Teresa Hawley, I have worked for the last 10 plus years in and out of Illinois state government, but about 2 years ago, left to create the Center for Early Learning Funding Equity at Northern Illinois University. Continue to work in great partnership with the state of Illinois on all of their work as well. And I'm going to present to you a little bit of work that started when I was in state government and has now kind of come to fruition in Illinois and what we've been learning there. And the next slide here, we have just a quick introduction of our center. The center is now a national center that's working with states all across the country on these same kind of issues about how to more equitably finance our early care and education system so that it does a better job of meeting the needs of kids and families and really keeping those children and families at the center of all that we do. So on the next slide, I'm going to give you a little bit of a sense here of where Illinois has been, what we've learned, and where we're trying to go in our efforts to increase the compensation of the early care and education workforce. So we have been in the process for the last several years of a wave of different initiatives that we have created to support our early care and education system. Starting back early on in 2019, when we got a preschool development grant, and this would be on the bottom of the screen, Accelerate Child Care Center pilot. We knew at that point that we needed to do a different way of investing in our early care and education programs to help them build their quality and to be able to engage in real continuous quality improvement. And so we created something called the Accelerate Child Care Center pilot. Accelerate Illinois is our quality rating and improvement system. I'll tell you a little bit more about that. But as you can imagine, we didn't think that when we launched it in 2019 that we were going to be doing it in the middle of a pandemic. We learned a ton as we did all of that. But at the same time, the pandemic did come and our state knew that it needed to get money out the door very, very quickly to save our early care and education system. We did require, like a lot of states, to close down programs, and then we reopened them sort of over the course of a weekend with a whole new set of rules, with allowing many fewer children in a classroom. And we recognized that there was going to be a huge financial hit to programs. So I'm very proud to say that Illinois was kind of first out of the gate with very, very large grants to centers, replacing about 30+% of their operating revenue as early as July of 2020 to be able to support programs. That allowed us, because we were doing that, we didn't have a big hole to fill when the ARPA money came and the stabilization grants came. We didn't have big hole to backfill for programs of money that they had lost. And so we were able to use the investment of the stabilization grants in a really important way to support the field moving forward and to focus in on these issues of workforce compensation. So I'm going to talk to you a little bit about what that looked like. As the lessons we learned from there taught us that this way that we were investing in programs was a good way to invest in them, investing not just in the per child rates that we were paying for subsidized children, but actually investing in the programs themselves. That has led to our governor making a historic investment in what is called Smart Start Illinois. It is a suite of programs that focuses on everything from early intervention to public pre-K to investments in the early childhood workforce, the child care workforce. And I'm going to really focus in on that child care part of it today, but know that it's much broader than that, and it is really trying to move our system to the high quality early care and education program with access for all families to what they need. in a gradual way. We don't have an unbelievable windfall of resources here in Illinois, but we have some great prioritization that our governor and our legislature have made to invest in this program. So on the next slide, we're talking about where we've been and what we've learned. The Strengthen and Grow Childcare Program was Illinois' version of the stabilization grants. It is what we used our ARPA funding for. But like I said, we had already invested in just trying to keep the help programs keep their doors open. So we were able to then transition in 2022 to requiring that funding to be focused on the personnel in the programs. And over time, we ratcheted up the percent of money that folks had to invest in their personnel, either making adding benefits for their staff, increasing salaries, providing bonuses to folks who are working in their programs. We focused that money in to try to get folks to be using those resources specifically on compensation. It was very popular with providers, and what we essentially learned most from our Strengthen and Grow Childcare Grant Program was that we could actually do it. I think if you had asked me 5 years ago, is it possible to do at scale a program where we're just giving grants to programs to be able to invest in their workforce, I would have been very skeptical that the state could pull something like that off. But an emergency gets you to be very creative, and I think what we learned from it is that we can actually do this kind of investment in programs at scale. On the next slide, we also learned from our Accelerate pilot a great deal about what it looks like to invest in higher quality in programs and how we might do this. This was a pretty small scale pilot. It was only 35 centers. We focused it in on rural communities where we had much less success in the past of getting programs to bring in what we call layered funding in our state. That means bringing in state pre-K funding or Head Start funding. We have a 0 to 3 education funding stream called Prevention Initiative as well. That hadn't been really happening so much in rural areas. So what we had done is a lot, many years of work of saying, why are we not seeing programs take up the preschool for all and bringing that into childcare centers? Why are we not seeing programs moving up the quality ladder within our Accelerate program? And what people were telling us was it really came down to 3 things. One, they didn't have the wages for the staff to have stable enough staff to do any meaningful quality improvement. 2, that staff didn't have any time out of the classroom to be able to engage in meaningful continuous quality improvement activities. And 3, when staff got better credentials, they didn't get a raise. And that was holding folks back from actually participating in all the initiatives we had to try to build up the skills of the workforce. So the Accelerate pilot was designed to address all of that. Again, it was a pretty small scale thing. We started out with these grand ambitions about individualized grant programs that were going to be tailored to each program's current wages and how much more did we need to give them. And we learned very quickly that that was an unimplementable mess, that it was incredibly difficult to do things on each program at a time, and very difficult for programs to deal with the administrative burden of the grant structure that we typically use in the state. So we were able to switch that all around to a much more streamlined contract format that was very zeroed in on increasing wages and adding a little bit of staffing to programs. So this program paid for an additional staff person, for like 1 additional staff person for every 5 classrooms. It really was that person that allowed people to take planning time in their day and in their week. And it gave dollar per hour kind of wage enhancements based on the credentials of the staff. Again, what we found was that this was relatively implementable. We were able to do it with the 35 programs. We know we need to learn a lot more to bring this program completely to scale. And so we are kind of moving forward in 2 ways in Illinois. This is our goal, is to get more programs into something like the Accelerate pilot program. But we have decided that where we needed to start first was because the wages were so incredibly low across the board in the field. We needed to start first with just basic investment in the early childhood workforce. And that is the core of the Smart Start Workforce Grant. So on the next slide, where we're going here. the idea that we, as I said, is we really have zeroed in on the idea that per child subsidy rates or tuition rates, that is not going to be what is going to get us to a better compensated staff and the ability to move programs into higher and higher quality. What the state is creating now is something we're calling a business operations subsidy, or a foundational funding approach that puts resources, sort of undergirds the program, gives them some stable resources to do things like increase teacher compensation. If you're in, this little graphic here makes a whole lot more sense if you watch one of the videos that we have. I don't have time to show it to you today, but I encourage you to go to our website, and they're going to drop that into the chat, that you can watch that little video that explains how we're thinking about using these foundational funding approaches to support better wages in the field. And that is what Illinois is doing. So I'm going to move on and just tell you a little more of the specifics of the program and how it's going to work, with a huge caveat here, right? This is all what has been proposed in the governor's budget. It is April 30th. Our budget gets passed by May 31st. We don't know yet whether the legislature is going to appropriate all the funding that this design would require. So this is sort of where we think it is at the moment, and this could change based on the revenues that are provided. So at the core of our approach with these workforce grants is the idea that a program now has their current revenues, and with that, they've been able to pay a certain level of wages for folks in the field. We need to give them more resources so that they can pay higher wages. And that it's a contract that you enter into with the state that says the state's going to give you a certain amount of money per classroom. And in return, you are going to agree to pay a certain minimum or base wage for each person in your program. So it is resources that are going specifically to raise wages. It is not some states are doing this in the design of, like, the state's going to give you X $1,000 per staff member, and you need to pass that directly through. That's not how we're doing it. We're trying to get everybody up to a certain level of wages. We're excited that there's so many different experiments out there, and hoping to learn from what other states are doing as well. On the next slide, a little more detail of how this works. So again, it's called the Smart Start Workforce Grants. To be eligible for this program, you have to be a licensed center or family child care home. You have to be open. You have to be a full day year-round program. So this is not for part-day programs. It's not for part-year programs. And importantly, you have to enroll a minimum percentage of children receiving our child care subsidy, which we call the Child Care Assistance Program. This is straight up because we did not have the resources to do the program for the entire workforce, which we know we need to do. But for equity reasons, we're zeroing in on programs that do serve at least some kids with child care assistance. And on the next slide, this explains it a little bit better, how we're doing that. For a child care center, you have to have at least 15% or more of your licensed capacity being taken up by a child who's using some kind of subsidy. We do include, by the way, folks who are getting subsidies from the military in our capacity here as well, because I think that's an important equity issue as well. If you're a family child care home, that means one or more of the children that you serve, or a group family child care home, which has about twice the capacity as a regular family child care home, you would need to serve at least 2 kids. And that we're doing this as any time between January and the date of the application, did you meet that mark, right? So we're trying to make it as predictable and stable for providers as we can, so they will know whether they have been eligible for this, and they have time. If they lose that subsidy kid, they don't lose this money right away. They have time to find another kid who uses the subsidy. On the next slide, this shows you where we're trying to get our folks in the field. I know that none of us believe that lead teachers should only be making $19.25 an hour. We want teachers to be making more of that. But this is where we could get with the resources we have now. And so we're trying to put this forward. I will say these represent pretty large wage increases in general, if you look at what the current median wage is that we have in really good data across the field of what people are being paid now versus where we're trying to get people as a minimum in a starting wage within their field, these are 13 to 20% increases in wages that are going to happen across the state. $5,000 to $6,000 a year. Many people ought to see their wages increase as a result of this investment that's being made. And that those increases may have sort of happened for some people already because of the resources that are out there in the field. But this is where we're trying to get people. We're trying to get the average wage of early childhood teacher up quite a bit from where it has been. What you can see here is that in home programs, they are also going to be required to pay their assistants a certain minimum wage. Now, home providers can't pay themselves a certain wage. That's not how their business works. They are business owners and they take a profit from their business. We want them to have a higher profit. That is what we're trying to go for because that is their compensation. But if they have an assistant, they also are going to need to meet these wage floors for their assistant. On the next slide, you can see the resources that we're going to give to these programs. So next slide here, the way this is being done is in quarterly checks to programs in advance. So if your grant is for October, November, December, you should get your check in late September, early October. $27,000 a year for infant toddler classrooms, $24,000 for folks serving age 2 to 5. This is not a school age focused program. And the reason in our state why that's higher for the infant toddler classrooms is because our licensing standards are designed to have 3 teachers in the classroom for like 12 infants or 15 toddlers. So that's why, whereas for 2-year-olds, it goes to 2 teachers in a classroom for 16 children. So that's how that's designed. And there's also funding if you are a family child care provider. It's $9,000 if you don't have an assistant. It goes up to $23,000 if you have 60 plus hours a week of assistants working in your program. So the idea here is we're trying to give you enough money to cover the cost, including all of the payroll taxes, all of that kind of stuff that would get you up to being able to pay these kind of wages in your program. We did a ton of cost modeling to make sure that that was the case, that these resources that we're giving people would allow them to get to these higher level of wages in their program. So that's the basic design here. I forget if there's another slide after this. Yes, this, like, how does it work? Before receiving Smart Start, a center might have been paying their starting teachers $17 an hour and their assistant teachers $15 an hour. Once they take the grant, they can't pay, they need to pay at least $19.25 or $18 an hour respectively, bringing their staff up to that wage floor. And hopefully that will be their starting wage, and they will continue to have a pay scale within their program. So people who are better, who have more experience, all that would actually make more than that. That's how we did the cost modeling. That's how we're doing the messaging to folks in the field. If you're a family child care provider, the idea is you're going to raise those wages for your assistant, but you're also going to increase your own compensation with these resources that we're providing. So that's the basic design of the Smart Start workforce grants. Again, investing straight up front in the basic wages of the field with the goal that the state has to then build on that to reward folks for having those higher degrees and credentials, and to provide programs the resources they need to have that out of classroom time for planning so that they can engage in the true quality improvement activities that we know they need to do to create this settings that kids and families can thrive in. We're very excited to share all of this with you.
Thank you so much, Teresa. I want to encourage everyone to take a little moment here. What are your questions for Teresa? Now's a great time to start putting those in the Q&A. What would you like to hear her talk a little bit more about? I'm going to turn the opportunity to present over to Rakaya Ambar Shaheen from DC Action for Children, who'll be talking to us about the experience in Washington, DC. And Rakaya, please feel free to say a few words about yourself as a point of introduction. I'll turn it over to you.
Thanks, Joan. Like Joan mentioned, I am the Director of Early Childhood at DC Action, and have been working on early childhood issues in the district for the past 8 years. The story that I will tell you, many of the things that happened in that story happened in the early years of my career in the district. So it's always interesting to look back on what things were like not that long ago. So I will share a little bit more about that as we go through our slides. Next. I wanted to let you all know first that I'm with DC Action, but I also represent Under 3 DC, which is a coalition of early childhood educators, providers, families, advocates, budget nerds, everyone that you can think of that work on building an early childhood system that is racially just in the District of Columbia. You can see some of the language that we use, but we really focus on racial and economic injustice and systems building. But the kind of the work that we do is often through organizing, a combination of organizing, advocacy, and policy analysis. Next slide. I will not spend a lot of time on these, but I just wanted you all to have a sense of our values. These are things that really play a major role in what we advocated for the Early Childhood Educator Pay Equity Fund. But again, we are focused on racial equity and racial justice. And next slide, please. We specifically call out racial justice, structural equity, so really thinking about systems building, economic mobility, and leveraging the strengths of our communities and building on those strengths. Next slide. I'm not going to go through this slide, but I just wanted to give you a sense of how long our journey in early childhood has been in the district. Some key moments are in 2008. You can see that we passed pre-K for all DC, which was universal public preschool for 3- and 4-year-olds. And then down in 2015, 2017, 2018, that's kind of where this work all kicked off in its kind of most recent form. So I will share a little bit about that. In 2018, we passed the Birth to 3 for All DC Act, which is a kind of meant to be a comprehensive legislation to correct what was the situation at the time and what continues to be the situation, which was severe racial disparities in the district, geographic disparities in the district. We're a small place. We have a population of 700,000 people, but we have very wide disparities in income and a variety of other outcomes like health, behavioral health, education. So previous slide. The part that's important for today's conversation is that we included in our legislation an establishment of publicly funded compensation for early childhood educators that was on par with public school teachers in the district who had equivalent roles, credentials, and experience. This is part of kind of what the lofty goal of Birth to 3 for All is, which is universal affordability for early childhood in the district. So the idea was we can't get to universal affordability, we can't grow the number of seats, we can't continue to provide high quality if we don't have educators who are meeting their own needs, who are being incentivized to advance in their careers, and not even just incentivized, but being supported to do something that they would like to do anyway, and to grow their education and credentials. Next slide. The important context for this is that we have public school teachers are unionized in DC, so they have a very clear salary scale with steps. And DC also introduced recently, around the time of the passage of the Birth to 3 law, but separate from it, education requirements for early educators that you can see on the bottom of the screen. The notable ones are for lead teachers. They had to have an AA in early childhood or some equivalencies, and assistant teachers had to have a child development associate by my charger just told me that it's not actually charging. I have to pause in a second. These were increases. I think assistant teachers before that had to have a high school diploma, and lead teachers had to have a CDA. The original implementation deadline was I think 6-ish years ago, so it was around the time of the passage of the law. But the district couldn't get educators to increase their credentials because they were being paid poverty wages near minimum wage. I want to note that in the district, we have a higher minimum wage than other places in the country. I think right now it's a little bit over $17. In 2008, I believe it was $13. But the early childhood educator salaries have hovered pretty close to those minimum wages along the way. Next slide. And Joan, please interrupt me if I'm going over. I am losing track of time. We didn't get funding for the first 3 years. We advocated for $60 million, kind of without a lot of data, but just some rough estimates of what we thought it would cost. Next slide. You can see some teachers in that picture in the back. And we worked with coalitions across the city to develop a joint revenue strategy that was focused on competitive, which are part of our revenue values that we have established as a coalition, knowing that in order to meet our goals, we were going to have to raise revenue, and we wanted to be aligned on how we did that. So we aligned with these organizations across the district and focused on tax justice, correcting inequities in the tax structure where high income residents were paying less than middle and low income residents. And so our approach was to modestly raise personal income tax rate on the highest income individuals in the district. Just for your reference, it's folks with an individual income of $250,000 or more, or household income with 2 earners of $500,000 or more. The resulting revenue was $75 million at full implementation for early childhood educator compensation. Many of the things that I'm saying have been slightly complicated over time, but I can answer questions about that or highlight things when they're really, really important. I'm not going to spend time on this, but I just want you guys to see that we, like I mentioned, put together a list of revenue principles. There's a long document that goes along with this, but just to give you a sense of kind of how we tried to think together, raising revenue is complicated in a coalition structure, and thinking about the many ways we could do it, and some of the more achievable ways often are regressive. So we wanted to not only advocate for revenue increases, but bring our coalition along in terms of how to do that in a just way that doesn't place the burden back on those we're trying to support most. Next slide. Here's just a slide of what we won. We divided it between 3 issues because we knew that policymakers weren't going to support a tax increase that got picked here and there and spread out over a bunch of not visible issues. So we selected 3 issues across our coalition to make sure that the changes would be really visible, and that the policymakers kind of would have the cover of being able to demonstrate why they raised taxes. Next slide. We use a lot of tactics. This was during the pandemic. So some of this is informed by that context. For example, we did a child caravan the day before the council voted on the budget, where we drove to different council members' homes. And one of the photos you saw earlier was at Councilmember Robert White's house, and educators presented him with a letter and asked him to vote in support of the revenue raiser that would pay educators better. There's a lot of other things I won't go into, just in consciousness of time, but we did kind of everything you can think of in a more virtual world, but we did do a rally or 2 as well. Next slide. These are just examples of our messaging. We can click through them. And finally, in order to implement the program, the council put together a task force that was meant to think through implementation to address some of the concerns and challenges that pretty much everyone had with how this was going to look. So it brought together a task force of advocates, there's an economist, there's a policy expert, there are center directors, family childcare home business owners, childcare association leads, teachers. I think there's a parent represented as well. And the idea was to think through, how do we actually implement all of these dollars? We have the money now, let's do it in a way that's really thoughtful. And had the priority of getting dollars out immediately, because we had the money. We didn't want it to sit around while we thought up a complicated distribution mechanism. And so for the first 2 years, the funds were distributed by direct payments to educators, of between $10,000 and $14,000 a year, depending on their role. And in the meantime, we would be developing the infrastructure to do a permanent program that would incorporate these funds into folks' salaries, so that they had permanent salary increases. So we did kind of a 2-stage approach. And we have just phased into this kind of second phase of funds going to providers who incorporate the funds into their educators' salaries. Some critical things that I forgot to put in my slides, but I will link in the chat, are the salary schedule for this program. So this is the first one. You can see that our goal, again, was parity with public school teachers. In DC, a public school teacher has to have a bachelor's degree. So our kind of pivot point is the bachelor's degree lead teacher, which is the last line in the link that I sent you. It's $75,000 a year, or 36-ish dollars an hour. And then every other role's salary is a percentage of that. And so we always start with that point, because that's where we have the exact parity with DC public schools, and then we reduce by a percentage based on what credentials they have or what role they're in. And you can see the lowest possible salary on our minimum salary schedule is $43,000 a year if you are if you're an associate teacher with without a CDA, and that is pretty close. It's not that much of an increase from what salaries were like before. As you know, they were $17 an hour at minimum, but it is a little bit of a bump for those roles, and a much bigger bump as your role increases and as your credentials increase. There's a funding formula. I'm going to link to it in the chat, but I'm not going to talk too much about it unless folks have questions. But the idea is, one of the really critical components of it is that we included in the funding formula an equity enhancement, which, to step back, all licensed child care providers in the district are eligible to participate in the Pay Equity Fund. So as long as you are licensed, you're eligible to participate. However, we wanted to make sure that we were funneling funds thoughtfully, and make sure that we were reaching providers who were supporting families with the greatest needs, who were facing the greatest barriers. And so we have an equity adjustment in our formula that increases the award amount based on the number of children in the child care subsidy program that program serves. It's based on the percentage, I believe, of their enrollment. And a few other things. There's an administrative enhancement as part of the funding formula, so to account for payroll tax increases and things like that. Funds go out on a quarterly basis, and all staff records are updated on a quarterly basis as well. And finally, in terms of what we've seen in impact, I'm trying to remember what the next slide is. You want to click over to it? Oh yeah. Oh, this is so important. I didn't even talk about it. We also included in it healthcare for childcare. That's why we have slides. Which is a healthcare, which provides healthcare for all staff of child development facilities. So the minimum salaries in our Pay Equity Fund program is focused specifically on early childhood educators. However, the healthcare program that comes through these dollars as well supports all employees of licensed facilities and their families. And it provides free or low premium health insurance for district and non-district residents who are employees of these facilities. And I think the next slide shows kind of the changes over time. I'm sorry, something I didn't mention to you all was that we have about the numbers didn't show up. About 4,000 early childhood educators. I believe that covered lives. Line has like a little bit over 1,000 educators in it. So to just give you a sense of the rates of coverage, I could do a whole presentation on healthcare for childcare, the amount of trust you have to build, the like how you build this type of program. But it has been a really critical part because we knew that many of our educators with the salaries that they had were receiving public benefits, they were depending on Medicaid, and if their salary increased, they would lose almost or much of that money just through having to privately pay for their own health insurance. So that was a really critical part of our work. That's from a recent rally because unfortunately we are in a bad moment in DC. The mayor completely cut the pay equity fund in the last budget, even though we had raised revenue specifically for the program because our budget, it's some drama. I'm not going to explain it to you, but there was some budget drama, and so unfortunately she made the decision to fully cut the pay equity fund in her proposed budget. The council, who is taking the next version of the budget and putting out the next version of the budget, has very strongly rejected that. We've heard from our chairman that he plans to reintroduce the entire program into his budget, which is great. I want to maybe note, we did everything you can in a budget to secure these dollars. We raised revenue for them. We put them in a non-lapsing fund. They're recurring dollars. We did the things that you can do to secure dollars, but the reality is that there is no funding source that is secure. And what we are working on is building the political power around these dollars that make it impossible for policymakers to take them out. And I think it has become very clear since the mayor cut these dollars that that's not something that's probably going to happen in the future. The amount of backlash, the amount of speaking out, the coverage that we've gotten has been pretty resounding, and I would be surprised if in future years we face threats like this. There are many other things to say about implementation hiccups and costs growing over time. I can't cover them all, but I'm happy to answer any questions.
Thank you so much, Rakaya. Really great and important to hear your closing comments there too, related to the fact that even when you do everything right, there's still a lot more to do to secure these wins for the long term. And building political power is one way to do that. So we're going to start out with a couple of questions for both you and Teresa, and then I'd encourage folks who have specific questions for Rakaya or Teresa to continue to put those in the Q&A box. But our first question for both Rakaya and Teresa is, what would you say has been the impact of your strategies so far, intended and unintended consequences? I know there's a lot of interest in our audience from the questions I'm seeing and understanding. Have you helped stem the outflow of early educators from programs? Have you helped programs be able to retain staff? What has the recruitment looked like? So Teresa, how about if we go to you first?
Well, I can tell you on the Accelerate pilot, where those 35 centers where we really zeroed in and provided the resources to be able to have that out of classroom time and the higher wages. So that was like our first wave of doing this at with a lot of money, like not just a couple, like $1 an hour kind of increase, but a more meaningful increase. What we've seen there is, so we saw in those centers, the staff grew. They had many more staff. They had less trouble retaining their staff. They had less trouble recruiting new staff. In fact, they reported that there were a number of people who had worked there in the past and had left, who's like, oh, I'm coming back. I'm going to work in this place. And we had hundreds of staff that went and got their next higher credential. So staff, when they saw that they would get a raise because they got the higher wages, they did go back to school and take advantage of all the scholarship programs and things that we have. So we saw some really positive impacts from that pilot program. the larger at scale work that we're doing now is too early for us to tell and to learn what we need to learn. I will say that, you know, we have this dynamic, which I know you have in Michigan as well, of the rising minimum wage that interplays with everything that we're trying to do with our early childhood policy. So we are seeing that wages across the board have been going up the last couple of years. We're hoping that gets a bit turbocharged with the investment that we're making.
Thank you, Teresa. How about you, Rakaya? Could you talk a little bit more about the impact of the strategy so far, both positive and unintended consequences?
Yes. So positive first, we have seen an increase in our workforce. And we saw an increase in the workforce starting in the first year of implementation in the program. We only have data from that year, although we are about to put out some new data on the second year of the program. Or we've only published the first year, is what I say. But we saw a 3% increase in our workforce in that first year. Some things that I'll note is that the way the program is structured, providers to participate have to meet the minimum salary requirements using their dollars. So all educators, and they have to comply by demonstrating that they've met those salaries. So all educators who are in participating programs, which is, I believe, about 2/3 of our programs are now participating. There are programs who don't want to participate because they're a religious program and they value their independence and they don't want to take government dollars. And there are some programs who don't believe they could afford to participate, and there are a variety of reasons for that. But we are at 2/3 participation. All those educators are making these salaries. We also are seeing an uptick in our credentialing for educators. I can't give you a causal description of that because there were also many changes that happened to those requirements. So there's been a few confounding factors, but we have seen more and more educators enrolling in higher education programs, getting their certifications or their degrees. So those have been good. In terms of unintended consequences, I think what we've learned about a lot of gaps in our data system for the district. The kind of where information has been accurate or hasn't been accurate, as well as from the organizing side of things, we've also learned about just really serious challenges in some cases, and sometimes just communication challenges internal to workplaces. Mostly nothing egregious. I mean, with a few exceptions, but educators feeling like their employer is not giving them the money that they're supposed to get. And a lot of times it's a communication issue, it's a trust issue. And so it's a really complicated program to talk about, and making sure we have the right messaging has been critical. We also rolled this program out all at once. We didn't do a 35 program pilot, which is a very smart thing to do. And so all of the kinks have had to be ironed out as the program's been rolled out. And so that creates some challenges. Finally, the big one that we're trying to contend with right now is the growing cost of the program over time. If we align ourselves, which we are aligned right now with the DC Public School salary schedule, that is renegotiated every 3 years. It goes up on average about 3%. Oh no, I'm going to plug my computer and I'll keep talking. It goes up on average about 3% every year, but okay. Sorry about that. It's plugged in, but the thing got pulled out of this thing. Okay. It goes up about 3% every year, but it's unpredictable. It doesn't always happen. It's contract negotiations. It happens when the negotiations end. And so and then on top of that, those costs just go up pretty quickly, especially as educators are getting their credentials. If you noticed on that salary schedule, there's a pretty significant jump once you have your bachelor's degree or your associate's degree. And so trying to control those costs has been really critical, in that we're succeeding. Like, we're seeing more teachers, we're seeing more programs participate, we're seeing higher credentials, and hopefully the impact of that is higher quality in our programs. And at the same time, in order to sustain that growth, we have to make sure we have the revenue. And so in a year like this, we're finding that challenging because the mayor cut the program. And so while we feel fairly confident that we will reinstate that program by the end of this budget season, the fact of having to get many tens of millions of more dollars is an additional fight that becomes very difficult in this context. So trying to think about how do we be really even-handed about protecting the educators who are in the program and the providers who are in the program, while trying to make some cost savings to give ourselves another year or two to get some additional dollars. So that's really critical when you're talking about people's salaries. You can't mess around with that. And getting our policymakers to take that seriously has been kind of the bulk of our advocacy work.
Thank you so much. So many states, including Michigan, have struggled with the potential for universal pre-K to bifurcate early education compensation, increasing wages for early educators serving 4-year-olds with the unintended consequence of incentivizing early educators working with infants and toddlers to transition to better compensated jobs in the pre-K system. So I'm going to start with Teresa. Did your compensation approach at all take this potential challenge into consideration, Teresa, or how are you helping to ensure that you're kind of growing all aspects of the system at the same time and not ending up making the workforce crisis worse?
Right, for sure. I think everything that Illinois has always been a very birth to 5 minded state. Well, while we have a very large pre-K program, it's always been done as a mixed delivery system with an emphasis on trying to make sure that that's done in the context that kids need the services, full day year round, all of that. But yes, all of our designs of these things have been across the 0 to 5 spectrum. So it is about what the qualifications of the teacher are, or the position, teacher, assistant teacher, not about what kind of classroom you're teaching in. So we have, and we see this as an important strategy that in the mixed delivery preschool world, there has been this idea of, okay, layer that funding into the childcare classroom for the pre-K funding. In Illinois, we do have a birth to 3 version of that kind of funding stream, but it's so much smaller and it serves so many fewer kids. It's not a realistic, and it's such high quality. I mean, it's the early Head Start kind of level of quality. That's not a realistic option to go from here to there to be able to fund the whole system. So as we've been thinking about putting these investments in the early childhood workforce, we're not doing any differentiation at all between an infant, toddler, or a preschool teacher. It's really about the qualifications that they have.
Thank you so much. Rakaya, would you like to offer a perspective on how DC has been working to try to prevent this bifurcation from happening?
Yeah, as I mentioned earlier, DC put universal preschool into place in 2008, 2009, and that was a bifurcated system. We had it's a mixed delivery system. We have for community-based organizations. I mean, it's a long story, but at the end of the day, community-based organizations receive public dollars and have to meet salaries that are similar to DC public school teachers. And the remainder of programs are in DC public schools for the most part. And during the intervening 12, 13, 14 years, educators of 0 to 3-year-olds have had significantly lower salaries, which has been really challenging and devastating for community-based early learning. This program attempts to begin to correct that. The idea is that every program that supports early educator salaries, so that means public school teachers who teach pre-K to 12th grade, the Pre-K Enhancement and Expansion Act, which provides funds to community-based organizations for 3 and 4-year-old teacher salaries, and then the Pay Equity Fund, all are tied to the same approach, which is that DC public school teachers salary schedule. So it attempts to kind of create that consistency across the entire program.
A question from our audience for both of you. So for both speakers, were representatives of the K-12 system generally supportive of these shifts and investments in ECE generally? And if yes, how did you build this support?
So I think we've really done very much an inside-outside game in Illinois, where the state has been taking the lead on the development of this program and this process, but working really hand in hand with all of our advocacy coalitions to push forward the investment that's being made here. That advocacy coalition is pretty strong, and it does include K-12 educators, although not particularly a focus. Is really it's early educator driven. But yes, there's been support for this.
How about you, Rakaya?
I would say similar. We haven't worked super hard to engage with the pre-K through 12 system, mostly because they have their own thing going, and there's not really any changes to that based on our work. We have had, in general, we've had some support. We've had folks speak out for us, but I will be honest that we've intentionally not engaged with them because there is a difference in that the district you have to be a licensed teacher to be to teach in TC public schools, and we don't have a licensing process for early childhood educators. And we didn't want to call attention to that difference, and we didn't want to create any kind of counter advocacy opportunities. So while we have heard mostly positive support from the Washington Teachers Union president and others, we've kind of stayed kind of out of that lane for as much as we can.
Understood. Teresa, we've got a few questions specifically about what's happening in Illinois. One question was around how did you decide to use 15% of capacity as a qualifying factor?
Yeah, so I mean, this is a combination of just the math that we had about the resources that we had and how many programs. It was sort of the maximum number of programs that we could cover while still maintaining a meaningful increase. So we had this little seesaw image that we showed in the what I have to say was an incredible stakeholder engagement process that the state did and as it designed this program. Yes, we would have liked the wage increases to be higher. Yes, we would have liked to serve a whole lot more people. And yes, we had a certain limited amount of resources that we had to work with. So the 15% cutoff is really based on the numbers that got us to where we could still maintain a pretty good increase in the wages, but have the right number of programs that we'd be serving. And then why did we do it as a percent of licensed capacity? That was an implementability restriction. So that's the only information that we have in our system is what is your license capacity. We don't even have it broken down by classroom or anything like that. So, and we have the number of kids that you serve on subsidy. So we were able to create that as something that you didn't have to prove to us. We already knew it. And so again, we're trying to make a very simple to apply for process here, not something you have to fill out reams and reams of paperwork in order to be able to participate in it. There was another question there as well as, how are private childcare centers engaging and being a part of this? So this was designed largely for what is a largely for-profit private childcare market in Illinois. In the city of Chicago, there are a lot of private childcare providers who have been able to participate in that kind of layered funding, either Head Start or Preschool for All. These grants are not for classrooms that receive state pre-K or Head Start, though they are already getting a layer of funding that helps raise wages, raise quality, all of that kind of stuff. We are really focusing in on the classrooms and the providers who don't have access right now to those other funding streams, and that's who we're focusing these resources on.
It looks like we have one follow-up around the 15%. Teresa, how does it work if people aren't able to be at capacity due to staffing? The whole reason why you're trying to do the initiative.
Yes. Yes, I mean, I think that we don't have a real workaround for that. So in the communities where you have a much higher percentage than 15%, we have a really high percentage of kids on subsidy, you would end up qualifying anyway, even if you had a lower number of kids, right? Because you would be 15% of your license capacity. This is a challenge, right? We know this is a challenge. We have been investing in programs for the last 2+ years with a lot of resources to try to get them back open and back up to their license capacity. So I think that that's going to be a challenge. It's one of the things that we need to look at in our implementation and our evaluation of this is like, are there unintended patterns that are popping up here in communities? People do have the option to go back and reduce their license capacity, which is, not a trivial thing to do. But that would help them if this is more of a permanent change that has happened to their program.
Got a couple of questions that came directly to me in the chat. So Teresa, could you talk a little bit about the funding source for what you're trying to do in Illinois and whether or not you'll have to continue to advocate for it annually? Or how will that
Oh,
work?
yes. So it is general revenue funds. This is a commitment that the governor has made to include this in his budgets throughout his second term. And it's going to be like any other kind of funding stream that we have. Our child care assistance program, which has a great deal of state general revenue funds as well as the federal money. Our state pre-K program, which is entirely funded through state general revenue. So it's going to require good, solid advocacy ever onward.
Yeah. We have a wondering from the audience about the additional resources for that third teacher. So this is above licensing. Could you just talk a little bit?
It's not actually above licensing. So,
okay.
So, you have ratio and you have group size, right? Our ratio for infants and toddlers is 1:4 for infants, 1:5 for toddlers. But the group size is 12 or 15. So you actually have to have 3 teachers at a time in those classrooms versus a preschool classroom where it's 1 to 10 and 20 children, you only have to have 2 teachers. So that's the big difference there.
I think
and we have to give money for more than just 2. Like, I mean, we funded it so that you would be able to have like 3.5 or 4 people getting a bonus or getting wage increases in infant toddler, 2.5 to 3 people, because we recognize, again, these are full day year-round programs.
Rakaya, we have a question in the Q&A. People would just love to hear a little bit more about the healthcare coverage. The questioner notes that Michigan tried something similar a few years back. We ran into legal challenges. How did DC stand up an AHP for early care providers? Is the question.
Yes. I think everything is contextual. So in DC, we have a state marketplace. So that I'm not sure if Michigan does. You do. Okay. That was kind of the key to it. And it is basically a premium subsidy for folks who are enrolled through the individual marketplace, and for employers. I'm not a healthcare person, but it's a similar version of that for employers. We haven't received any legal challenges. If you want to learn more, I would definitely be happy to connect you with our Health Benefits Exchange Authority director, who is extremely thoughtful, has been super hands-on with this, and has been really thinking about how to weave federal premium subsidies with this program, so that we can make the most out of the dollars that we have, the public dollars that we have. Might not have answered your question, but that's probably the ceiling of my healthcare knowledge.
Very good. Teresa, one of the questions that we had was related to the provision of technical assistance to help childcare businesses apply for your program. And could you just talk a little bit about what you're doing to ensure your messages are reaching folks that are potentially eligible, and what resources for technical assistance are available to them?
Yep. We do have a pretty robust childcare resource and referral system in Illinois. And so that all of the administration of this these grants has been through the Illinois Network of Child Care Resource and Referral Agencies, INCRA it's called. And so that, and then the CCR&Rs themselves have been tasked with doing that technical assistance and support for folks. We have the helpline, we have all the, and it's also, our applications for all this are built into our normal operating systems for things like Accelerate Illinois, our workforce registry, which is mandatory for folks who are licensed within our state. So we've tried to, we tried to do good design as our number one kind of technical assistance to make it easy to apply for in the first place. But then we do have those sorts of supports built around it.
Great. I'm just looking to see, I don't see any questions. I think we might have maybe one more question in the Q&A as we segue to our small group. It was a question for you, Teresa, around the minimum number of families receiving state subsidy for a program to qualify. Maybe you could just answer that a little more specifically.
Yeah, so it's the 15% of license capacity, or it's 1 if you're a family childcare provider, or 2 if you're a group family childcare. And that was because we don't want them to have to try to calculate 15% of 8 children.
Right. Absolutely. Keep it simple. That's the message that we have heard from our childcare business owners in Michigan. Help us be successful in applying for these funds, and we need you to keep it simple for us. Thank you both so much for your presentations today. I know they've been a lot of inspiration given the questions. I just want to say again how critically important this topic is for the early care and education field in Michigan. I encourage all of you to educate others about what you learned today, to share these important messages and takeaways from other states, and to join us in our work to continue to advocate for improved compensation for the early care and education workforce. My contact information is on the screen if you'd like to reach out to me directly. And thank you again for your time. Take care and be well.